Hi everyone. So today I wanted to kind of talk about female pattern hair loss or androgenetic alopecia. So that's the kind of hair loss or hair thinning that females develop as they get older. Typically starts in the 30s, and then there's progressive thinning throughout 30s, 40s, and eventually, if untreated, the hair can end up pretty thin. It's the female equivalent of the male pattern baldness that we're all very familiar with. So how do we address that? So we're very lucky to live in an era where there are a ton of treatments that can be used to really decrease the progression of the disease and also, improve the course overall and regrow some hairs. Number one thing to keep in mind is it's a chronic condition, so you're not going to cure it. So you have to accept that and address it as a chronic condition, which means whatever treatment you use, you're going to have to stay on indefinitely. Of course, there's a chance that in the future, a new treatment will come along that will be more curative, but we're not there yet. So the first thing we do for female pattern hair loss or pills. I typically will hit females lightly or aggressively, depending on what type of results they're expecting. The pills that we use for female pattern hair loss are, one is minoxidil. So the same ingredient in Rogaine topical as a pill. So it's a vasodilator, increases blood flow to the hair follicles, and with that you get more hair growth. So it's a grower. There's also the topical version, the topical minoxidil, but the oral has been shown to be much more effective, and side effects are really minimal, maybe a little bit of hair growth on the face, but we barely even see that. In general, minoxidil is a blood pressure pill, so keep that in mind. But we use very, very small doses for hair loss where the blood pressure is really not affected. Another pill that we use for female pattern hair loss is finasteride, the same finasteride that guys use, but females use it too at a slightly higher dose. We typically use that on females that are not intending on getting pregnant anymore. So it's a testosterone inhibitor, and it helps, the female pattern hair loss by blocking testosterone, since the condition has a huge hormonal, element, unstable hormones, just like, acne has. And then the third pill we use is spironolactone, also targeting the hormonal element. It's an indirect testosterone inhibitor, happens to be a diuretic, so you have to be cautious about staying hydrated. So for people that want to be very aggressive, we really give them all the pills in combination with the fourth pill, which is a multivitamin. So we use something called Nutrafol or Viviscal. Those are hair-specific vitamins that can be pretty effective. If those are expensive or you don't want to, spend money on that, then, just a women multivitamin boosted with vitamin D is a good idea, or a prenatal multivitamin, which has the advantage of extra iron, which is pretty good for hair. So we talked about pills for hair loss. We, of course, also use topicals. Topicals, don't do a whole lot, but they can be helpful. So if the person also has dandruff, we address the dandruff with a shampoo. Ketoconazole shampoo is the common one that we use. Sometimes, Loprox shampoo is another one. And if the dandruff is very severe or the scalp's very itchy, we add a topical steroid solution to help with that. And so let's say you've tried the pills, you've tried the topicals I mentioned, and the hair is just still shedding, continues to thin and not growing. So there is a procedure you can add to your regimen, and that's PRP, platelet-rich plasma. We draw blood from people, extract the portion that has a bunch of growth factors, and inject on the scalp. You do multiple treatments initially, a month apart, and eventually go into a maintenance phase, which can be every 4 to 6 months. The downside to PRP is that, one, it doesn't work for everybody. And it's expensive, but it's definitely worth a try. And I would say about 60% of people will see, some regrowth with that. Majority of people will see decreased hair shedding and then hair strand thickening, which gives you the impression of like larger density of hair. There's another treatment called exosomes. It's a little bit, more experimental, but sort of same principle of the PRP of, stimulating growth factors to regrow hair. It can be used as sort of like a last resort option if other things have failed. So we at Skin Tap are happy to offer you with all the pills, topicals, and refer you to a good PRP place if you feel that that's what you want for your hair loss. So don't just sit on it. Come see us so we can help you.